Hi, this is Dr. Bharadwaz. I am CEO and homeopathy doctor at Fidicus Homeopathy. Today we will discuss on one of the important topics, that is autism spectrum disorder, and also signs and symptoms of autism spectrum disorder. So what signs the patient should have or the kid should have so that they can get the diagnosis of autism spectrum disorder. It is so confusing that many people diagnose it very wrongly. Now we will see into scientific lens. This is especially for the parents of the autism kids. So you are afraid that your kid have autism, or someone has said in your relatives or in your friends that your kid has autism spectrum disorder. You don't need to worry about that. If you see this video completely, you will have fair idea about what is autism spectrum disorder and also what is not autism spectrum disorder. You have to differentiate. See, everyone in this world have the traits of autism or the symptoms of autism in a very light manner. Everyone, even I have that, you have that, every people in this world have that. So every person who is having the traits of autism may not be accounted to autism spectrum disorder. There is a clear cut difference between diagnosing a kid as autism spectrum disorder, or the kid may have autism traits but it may not amount to autism spectrum disorder. If you see this video completely, you will differentiate between what is autism spectrum disorder, what constitute autism spectrum disorder, to what extent the kid should have so that they can get the diagnosis of autism spectrum disorder, or what is not considered. It is very important for you to understand what is not autism spectrum disorder. Many of your relatives or friends will say your kid is autistic, get him to a psychiatrist. You don't need to worry about that. If you watch this video completely, you will understand what is autism spectrum disorder, who will get the diagnosis of autism spectrum disorder, and what is not autism spectrum disorder. You should not be worried about if it is not full blown autism, or the kid may not get autism spectrum disorder diagnosis but he may have still some autism symptoms. Everyone has that. Okay, now we will deep dive into autism spectrum disorder signs and symptoms. Next point you have to understand here is autism spectrum disorder. The important word here is spectrum. Spectrum means there is a wide range. It is not one or two symptoms, it is a huge range of symptoms. Whenever you think of autism, you need to keep in your mind it is spectrum. So for example, the causes for autism are innumerable, so we call it as spectrum. So there are a lot of genes, around 500 to 1000 genes involved in autism. It is not a single gene, two gene, or 10 gene. So it is a spectrum. And also the symptoms of autism, what we discussed, there are huge number of symptoms of autism. So that's the reason it is spectrum here as well. Whenever you think of autism spectrum disorder, you have to concentrate on the word spectrum. So no autistic child in this world is equal. For example, your thumb impression is unique, your face is unique. In the same way, each autistic child is unique, but they share some common characters. That's it. So if you take 1000 autistic children, the reason for autism in the 1000 children are different. The pathology or the changes that occur in the body for 1000 children are different. The symptoms they express are different. So the treatment will also be should be different. So homeopathy offers you, if there are 1000 kids, they will get 1000 different medicines. So the treatment for autism in homeopathy is also a spectrum. Here you have to remember that there are no common signs and symptoms. Okay, they have, the symptoms may have common characteristics but there are no common symptoms. All the symptoms in every individual are different. Okay, now we will go one by one. This is a chart taken from DSM-5. DSM is Diagnostic and Statistical Manual of Mental Disorders. This is proposed by American Psychiatric Association. We have to discuss autism from their context. So that is a standard book or standard way of defining autism or diagnosing autism. So this is DSM-5. From DSM-5, we will look into deeply what is autism here, what are the symptoms of autism. First one is persistent deficiencies in social communication and social interaction. This is the first definition they have given. What is meant by this? There are two things here: social communication and social interaction. So how the kid behaves socially is very important here. How he is interacting with the other kids or the parents or the elders in the family or the kids who he is coming into interaction with. So here is the difference, that is the more concentration. The first one is social communication and interaction, persistent deficiencies. Okay, what are these deficiencies? We will look one by one. First one is defect in emotional reciprocity. Normally kids are emotional, right? They get anger, or they get fear, they get sadness, they are happy sometimes, or they are sad sometimes, and also they have contempt, they have surprise, they have jealousy. All these are emotional things kids also can express, but these autism kids cannot express sorrow, or they cannot express joy, they cannot express anger, they cannot express fear, they cannot express contempt, or they cannot accept jealousy. For example, when the father or mother taking other kids into their lap, those kids need to get jealous, but these kids will not express it. So they are very, see, the very foundation of human being is emotions. They are lacking in the emotion, so all these emotions they are not able to express. Severe social emotional reciprocity, so they will not respond to the emotions. For example, if you are showing love, they will not show love back. If you are showing anger, they don't understand. If you are showing fear, so you have seen some lion or something and they are not able to grasp it, so they are not able to understand emotions and they are not able to show their emotions. That is the problem with these kids. First one is abnormal social approach. So when a kid is approaching another kid, they should smile, right? They should pull them, they should do something to them, or they should hit them, something they have to do. But this emotional social approach is not there with them. And also failure of back and forth communication. See, normal kids interacting with the other kids, so they will give something, they will take something, or they will speak something, and they will receive something from the other kid. So this back and forth conversation with other kids, or the parents, or the elders, or the peers will not be there with these kids. Reduced sharing of interest. So normally kids who like a particular thing will group together and play, so this is lacking in them. And also they will not share emotions and affections. Okay, so if the kid loves his elder brother or sister, he will show love, right, by giving something or by playing with them. Or if the kid, he or she loves his parents, so he will smile with them. All these are lacking in these kids. And also failure to initiate conversation. Normally when you see kids, some kids are very active. If you go on road, they will call you and speak to you, right? So there is no initiation of conversation. Even other kids come to them to play, they will not get initiated. And also they will not respond to social interaction. So see the autism kid, so if other kids come and try to play with them, he will not notice the other kids. He doesn't know that other kids are existing. Such is the lack of social interest or social interaction. They will not have, respond to the social interactions. This is the first one, deficiencies in social emotional reciprocity. Okay, next one which comes under persistent deficiencies in social communication and social interaction is deficiencies in non-verbal communicative behaviors used for social interaction. Okay, they are, see, not only speaking, and also there are a lot of things. There is body language, there is facial expression that kids will understand and kids need to show, but they are not good at understanding the body language or the facial expressions or the emotions of the face. And also behaviors or social interactions that are related to non-verbal communication, so facial expressions, body languages, so tone to which you speak. So they can be lovely tone, or they can be anger tone, they can be a tone that is different when you are afraid, when you are sad. So these guys are not able to differentiate the emotion behind, or the they will not able to understand the body language, facial expression. First one is poorly integrated verbal and non-verbal communication. So they are not able to understand any verbal or non-verbal communication. What it means is they are not able to speak. And also if someone tells something to them, so they are not able to understand and register it. Not only that one, if someone is trying to show some anger, they will not understand through facial expression. They are, someone is trying to show some sorrow. See, normally kids are intelligent. If you are sorrow, they will come and they will try to play with the mother or the father. But these guys will not understand the social communication that is coming out through non-verbal communication. So and also if there are any gestures in the family, so for example, if a kid needs water, he will show like this. These kids are not able to understand those gestures, or they are not able to tell anything to the parents through the gesture. Normally what happens is, for example, if a kid needs ice cream, what he does, he will catch hold of his father or mother finger, and he will take them to a refrigerator, and he will make them open the refrigerator. And if you take something else, the kid is not wanting from the refrigerator, they will say no. And until you give the ice cream, they will pursue it, and they will try to express or communicate. But these autistic kids are not able to do that. So that is the problem with the autistic kids. This how you can recognize if the kid is having autistic traits. And abnormal eye contact or sometimes no eye contact itself. So this is the most important for kids. Normally, when you are playing with the kids, most of the kids will have eye to eye contact. So when you go to the mall or when you see a kid of your relatives, so when you are playing peekaboo, so they will have direct eye contact. Normally these autistic kids will not have direct eye contact, or they will have abnormal eye contact. They will be seeing somewhere else in your body. For example, if they like a small button on your shirt, they will be looking at the button, or something flashy on the dress, they will be concentrated on it, that rather than when you are speaking, when you are looking at them, there will be no eye contact, or there will be abnormal eye contact. Sometimes they will have difficulties in understanding gestures, and there will be difficulties in understanding and using of gestures. For example, if you need water, so kids will show like that, or they will point towards a water bottle. And also, if mother says that do you want water, they are not able to understand it. They are not able to understand the gestures, and they are not able to show the gestures. This is the problem with the autistic kids. Total lack of facial expression and non-verbal communication. So normally you can see the kid by his face itself, you can say that he is happy, he is sorrow, he is angry, or he is sad, he is surprised, or he is jealous when other kids goes into the lap of their father and mother. All these facial expressions can be seen in kids if you observe carefully, but you cannot see these, or these facial expressions are diminished in the autistic kids. So you have to understand that. Next one is deficiencies in developing, maintaining and understanding social relationships. They are not able to understand the relationship between them and the father or mother or people around them. They are not able to maintain the relationships, and also they are not able to understand, maintain or manage the relationships. They have difficulties in adjusting behavior to their various social contexts. So when you are with other kids, you have to behave differently. When you are with father, you have to behave differently. And when the kids see the stranger, he has to behave differently, right? He cannot be as close with the stranger as he is with the father or mother. So these contexts, these people are not able to understand. So they cannot differentiate between the social context of playing with other kids, playing with elders, playing with their peers, playing with the kids who are junior to them. So these they are not able to differentiate. Sometimes what happens is these people are more close with the elders than the people of their age or people below their age, because adults can understand what is going wrong with this kid, but other kids will not be able to understand what is going wrong with this kid. So these people are more attached to the elders than their peer group, or they like to play with the elders than compared to their peer group or the people who are less for their age. Okay, this is the most important thing. Next one is difficulties in sharing imaginative plays or making friends. Normally you see kids, they will play imaginary plays, right? They think that there is a ghost, or there is a doctor in their family, or there is a thief and police games. Lot of games are there. These are imaginative games. Normally kids play this, but autistic kids have difficulty in this. For example, some kids come and say that you behave like a doctor. They will not understand it. How can I behave like a doctor? Or if I am a thief in the play, how should I play? How can I become a thief? They will have difficulties in comprehending and playing these imaginative roles. They say that I cannot be thief, I am not the thief, I am not the doctor. They will say those kind of words, are they are confused how to play this when they are not good at it. So they are not able to understand these imaginary plays, and they will be away from these imaginary kind of plays which normal kids regularly play. That's the reason they are outcasted from the group in the society. Next one is absence of interest in peers. So normally kids play well when they are with the same age of other kids. So but these guys are not able to gel with the peers. They are not able to understand their language, they are not able to communicate. That's the reason they are not interested in the peers, or that they are not interested in the kids of their own age. Maybe they are more interested in the adults, because they are able to understand that these kids have some problems. That's the reason they tend to be more close with the elder or upper age group than their regular age group. Next important thing we need to discuss is restricted repetitive patterns of behaviors, interest or activities. These kids will have restricted activities. They are not full blown activities. When they are doing something, they are not able to do it completely. And repetitive patterns, whatever they do, they will repeat it. They are afraid of doing new things. So because their intelligence is so low that they are not comfortable with doing new things or understanding new things, they will do the same thing again and again. Maybe it can be a behavior or an interest or an activity. We will look deep into it one by one. First one is stereotyped or repetitive movements of objects or speech. See, they are playing with the object. They are play with the same objects every day and every time. And also they are saying something, or some kids say they hum particular song. They see only that song. Other than that, they will not like anything. And also most of the kids, what I have seen is, if they like a particular cartoon, they want to see only that cartoon, so that they are well aware of it. Understanding new things or seeing the new cartoon or understanding the new cartoon is burdenful to them. That's the reason they will stick to the same things and do the same things again and again. First one is simple motor stereotypes. What is simple motor stereotype? For example, if they are doing a repetitive movement, so when they see sucking of thumb or doing something with their hand, so flapping of the hand, they are doing flapping of the hand. Whatever they do, they are repeatedly doing it. And also they are lining up of toys. For example, these kids, whatever toys you give, they will line them up, because intelligence is so low that they are not able to understand what actually the toy does. And see, if there are 10 toys, there are 10 different ways of playing with the each toy. But whatever toy you give to them, if they are lining up, means they are doing the same thing, right? There is no need for them to use their brain. So instead of understanding the toy, instead of opening the toy and seeing what is inside, what they do is they will line up the toys. So it is very easy, right? Rather than, there is no need for you to use the brain. So you can understand that if whatever the toy you give, they will play in the same way. I have seen a kid, whatever you give, he will throws away and listens to the sound. So whatever you give iPhone, he will throw down and listen to it. If you give a car, he will throw down and listen to it. It is very easy, right? Rather than understanding what the toy does, and if there are 10 different toys, they have to understand 10 different ways of playing with the each toy. But they are not able to do that. That's the reason they will do same thing with the toy. Or echolalia. Some kids have the habit of echolalia. When parents say something, they will repeat it again. When grandfather says something, they will repeat it again. When peers say something, they will repeat it again. When other kids say something, they will repeat it again. So rather than using the energy to understand what the other kid is saying, father is saying, grandfather is saying, it is easy to repeat it, because they are not able to go into new things. They don't want to do the new things. They want to repeat the same thing again and again. Or they say some idiosyncratic phrases. They have heard something in the cartoon. They will listen only to those words, and when that cartoon comes, they will repeat the same word again and again. There may be different episodes of the cartoon or different things about the cartoon. In the same cartoon movie, they will see different scenes, but they are fixed to only one thing and repeat the same phrase when that cartoon comes. It will happen in the different areas of life. For example, you have to speak differently with your mother, differently with your father, but they will not do like that. They will remember one phrase and repeat the same phrase with the father, with the mother, with the peers, so that they are afraid of venturing into new things. Next one is insistence on sameness, inflexible adherence to routines or ritual patterns or verbal non-verbal behaviors. In this, see, they want to do the same things again. For example, they want to wear a particular dress, they will wear the same dress every day. They want to go and eat in McDonald's a particular dish, they will eat that particular dish every day. Okay, they will have same habits or same behaviors repeating every day. First one is they have extreme distress to small changes. For example, every day the kid has to wear the red dress and the green shoes. If you change anything in their dress, they are not able to register it, and they go into distress or they feel anxious about it. They have difficulties with transition. Normally, if they are at home, they are comfortable. They need to go to their grandfather's home or their uncle's home, their aunt's home. They are not comfortable with that. So they are not comfortable with the changes that are going to occur. So you have to sleep in a different way, or you have to eat in a different way, you have to behave in a different way in others houses. But these guys are not open to these changes. So that's a very important observation you can do in these kids. They have rigid thinking patterns. For example, if you give something to them, he will think only in that way. If you give other thing to them, he will think only in that way. For example, if you give a stick to him, he will use it to beat. Or if you give something, if you give laptop to him, he will use it to beat. So he is fixated to do one thing, whatever the object you give. Or and also how he is behaving with his father and mother, he will behave same way with his other kids or with his uncles and aunts. So they will not able to differentiate the relationships, or they are not able to change their thinking patterns. And also they will have rigid rituals. If they wake up in the morning and have the habit of saying good morning to a person, they will go and say good morning to everyone in the family, or they will go and say good morning even to the pets. They will have rigid greeting rituals. So in the morning they will say good morning, in the afternoon they will say good morning, in the night they will say good morning. They are not able to think in afternoon you have to say good afternoon, in the night you have to say good night. They will not think all those things. They are afraid to think, or they are fixated. They have low intelligence that they don't want to do all kind of things, so they will fix to only one thing. Basically they want to avoid the changes, or they want to avoid thinking. They will take same route, or they will eat same food every day. I know a particular girl who wants to wear red dress every day, and also she wants to go to McDonald's and order one French fries. Along with that, she wants peri peri flavor as topping on it. That kids want every day the same thing. She will not other than this. If you give her ice creams, or if you give anything else, she don't want to eat. She want to wear red dress and go to particular McDonald's, only that McDonald's. So she doesn't want to go to another McDonald's also. So she want to go to a particular McDonald's near her home every day. If she is taken to another McDonald's also, she don't like it. She wants to go in the same route as well. If the route is changed, she is not comfortable with it. If she is seeing everything from the window, right? If you go into different route, she will not accept it. You have to go in the same route, and you have to give the same dish at the same place every day. So such is the rigid ideas or rigid behaviors they have. Next one is highly restricted fixated ideas that are abnormal intensity or focus. They have hyper focus on anything. So highly restricted fixated interest. So I will give you an example for this. And abnormal in intensity and focus. Okay, strong attachment to a preoccupation with unusual objects. Before going to this, what happens is they have fixated interest. They want to do only one thing repetitively, and also their focus is hyper focus. They are doing something which they are intrigued by. They cannot be disturbed. I have seen a kid where he takes the lids. It can be lid of anything. It can be lid of a cup, or it can be lid of a bowl, or whatever he says. He will pick that lid and drops it down, and he will listen to the ringing sound. When it vibrates on the floor, right, he will listen to the ringing sound. When he is doing that, you cannot disturb him. So whoever comes, whoever goes, whatever it may happen, he will not be disturbed by it. Okay, I have seen his grandfather. What his grandfather does is, his grandfather collects all the lids from the house when he go to his place and give it to him. Okay, such is the rigidness which they show. They have fixated interest. They are intrigued by, if they are intrigued by something, you cannot do anything to them. In the same way, I have seen some kids who are addicted to a particular cartoon. They will see that cartoon, other than that cartoon, even same episode, if you keep the new episode of the same cartoon, they don't like it. Every day same cartoon, same episode, they will be looking day by day, and they are intrigued by it. When they are looking at that particular cartoon, you cannot disturb them. Such is the intensity of highly restricted fixated interest, that are abnormal intensity and focus. The next one is hyper or hypoactivity to sensory inputs, unusual interest, sensory aspects of the environment. For example, they have abnormal sensation. For example, if you touch a warm thing, it is not too hot or too cold. You have to understand it. Or if you are touching something very soft, you know that it is very soft. Or if you are hearing some voice, someone is whispering into your ears, it will just be a whisper, right? But for these kids, they will have abnormal sensation. For example, I have seen one kid. If the temperature is warm, if he touches he cries because he feels that it is more heat. Okay. And one more kid I have seen is, if someone whispers into his ears, if you talk normally nothing will happen, if someone whispers into his ear, what he does is he goes bonkers. We don't know what is happening in their sensory area. Maybe he is hearing loud sounds when someone speaks into his ear. So they all have abnormal sensations which cannot be explained by other people. So, and also I have seen a kid, he wants to play with bubble wrap. Unless you give bubble wrap, he is satisfied with this. Every day he wants to use that bubble wrap and he wants to break that bubble wrap. If he don't use that bubble wrap, he will be hyperactive, or he will not accept that. So, and also some textures. I have seen one kid who wants to play with sandpaper. He will be taking the sandpaper and rubbing whatever he sees, and he enjoys that. So, and also he always puts his hand on the sandpaper and he rubs it. Maybe he is feeling soothed by it, or whatever happens, we don't know. But these guys have abnormal sensory habits or sensory repetitions. So maybe it can be a sound, or it can be pain or temperature. Normally when you prick with a small pin, it will not be much painful, right? But these kids, when you prick with pin, they will feel huge pain. They are hypersensitive to pain. And also they like or they hate specific sound. Or sometimes what I have seen is they like excessive smells. One kid I have seen, he liked the smell of the salt. He want to smell wherever in the dining table, he goes to the salt, he open the salt and he smells it. They like smells of the salt, or they will hate, or they are afraid of some smells as well. And also some people, or some kids are afraid of lights. So when the light is blinking, they are not able to tolerate it. When the light is straight, it is coming continuously, it is fine. When the lights start blinking, they are afraid of it. So what I want to say is, these kids will also have abnormal sensory inputs or abnormal sensory behaviors. Next symptom is, symptoms must be present in early developmental period. You cannot say until 15 years of age the kid is okay, everything is fine, and at 15 years of age he developed these symptoms. That cannot be considered autism. I am now saying, till now we have seen what is autism. Now I am saying what is not autism. What I mean to say here is, these symptoms should be present from the childhood. It is not that after 20 years, at the age of 20 or at the age of 30, if these symptoms appear, it is not considered as autism. And also, important thing, what is not considered autism, you have to see, symptoms cause clinically significant impairment in their social, occupational, or other important areas of current functioning. This is the most important thing to differentiate what is autism, what is not autism. See, any of this can be the trait of autism, but it may not amount to autism. This is the important thing. What it is saying, the symptom should cause clinically significant impairment in social. First one is social. Even I have autism symptoms, you have autism symptoms. Sometimes you are not able to express, sometimes you are not able to understand the gestures, but it will not amount to autism. Because of this, the social interactions are not lost. I am maintaining, you will maintain, you have problems in understanding. Some people, women say that my husband will not understand. It doesn't amount to autism. Okay. So in that, what context in social means, if they are able to maintain good relationship with their spouse or parents or the colleagues in their workplace, there is no problem. There might be light problems, but it will not be significant. Okay. After impairment in social, next we look into occupational. What it means is, even though all the people have autistic traits, they are able to pursue their occupation. They are able to do whatever they want. They are able to gel with their seniors or their management. They are able to gel with their peers. They are able to gel with their subordinates. So these guys are not able to do it. They will have severe impairment at occupational level. They will have constant fight, or they are not able to understand their peers, or they are not able to work and support their family or support themselves. So only then you consider it as autism. If you have symptoms and it is considered autism, it has to be significant impairment at occupational level also. Next one is, one more important term they have mentioned is current functioning. Whatever you are doing currently as a kid, whatever you have to do, you have to do, but you are not able to survive as a kid independently, or as a teacher you have to teach, right? as a student you have to learn. So whatever current functioning you are in, so if you are not able to do that function, you have difficulties in doing that functions, then only it is considered autism. And you are able to do, even though you have symptoms, you are able to do everything you have to do at that particular age in the particular context, it will not amount to autism. So here is very important three things. One is significant social impairment, occupational impairment, and current functioning areas. You have significant impairment in these areas, then only it amounts to the diagnosis of autism. Otherwise it is just autistic symptoms, everyone will have it. Next one is, this is an important thing, there are two other diseases or disorders in psychiatry which are very close to autism. Autism can occur along with this, or it can be independent of these two disorders. First one is intellectual developmental disorder. Okay, intellectual developmental disorder is completely different from autism. Sometimes it may overlap. Autism kids may have intellectual development disorder, but intellectual developmental disorder can be standalone. It should not be confused with autism. What is intellectual developmental disorder means? Some people will have low IQ, they are not able to function properly, or they have adaptive difficulties, they are not able to adapt to particular situation because they have low intelligence. So low intelligence will not amount to autism. Low intelligence or intellectual developmental disorders are completely different from autism. You should not be confusing. These are two different diagnoses. Next one is global developmental delay. Global developmental delay is one more disorder which is mentioned within psychiatry in DSM-5. Global developmental delay means it can be diagnosed within the kids below the age of 5. Whatever the milestones they have, so walking, speaking, eye contact, stranger anxiety, whatever the milestones the kids has to achieve in that particular age group, those will be delayed. Even that has to be differentiated from autism. These two things, intellectual developmental disorder and global developmental delay, these are should not be confused with autism. Autism is completely different from these. Sometimes these two may coexist, but they have to be diagnosed differently. Even sometimes autism can be standalone without this, and sometimes it will be combined with this, but you have to differentiate. Having this problems is not autism. Okay, sometimes it may coexist, but you have to differentiate. It is very important for you to understand all these things, so that you can understand what is autism, what is not autism, so that you can help your kids in future in the current context also. Coming to the conventional treatment, or English medicine or Western medicine, or the treatment given by a psychiatrist in a corporate hospital or in an individual setup, is known as conventional treatment. What this does is, they have no good medications for autism. Whatever they give medication, they will mess up the dopamine system, they will increase or decrease the serotonin, they will increase or decrease oxytocin, vasopressin. Sometimes they will give antidepressant, antistimulant, anxiolytics. Whatever they do is, see, dopamine system, serotonin system, or these are the very important hormones in our body. Dopamine plays very important role in motivation. Serotonin plays a very important role in how you are satisfied in your life, and oxytocin is a bonding hormone. Vasopressin is also a bonding hormone in males, especially vasopressin. They will mess up these hormones because they deal with these hormones. Already you have a lot of imbalance in this. When they try to give these hormones or the things that increase or decrease them from outside, your kid's brain will go for a toss. That's the reason they have a lot of side effects. This is not the good way to treat them. They think that they don't have options, but homeopathy is the best option. Other than that, they will use, if the kid is looks depressed, they will use antidepressants. If the kid looks dull, they give stimulants. If the kid looks anxious, they will give anxiolytics. So these are all the drugs which are having high side effects. They does more damage than autism to the kid. That's the reason you have better option with homeopathy. Now we will look how homeopathy can help in this type of kids. So prevention, if you use homeopathy, if you have any problems before the birth of the child, for example, if you want to get pregnant, you are not able to get pregnant, you have fertility issues, use homeopathy. You will not have any side effect, or even the kids that are born will not have side effects. One of the major reasons for autism is using medicines that are related to fertility to get the kids. So autism can be prevented using homeopathic medicines. Once you have autism, In some of the cases, it can be completely cured, or the symptoms can be reduced. The frequency of the symptoms can be reduced, intensity of the symptoms can be reduced, duration of the symptoms can be reduced. So everything can be reduced by using homeopathy. And once, sometimes it may not be cured completely, but it will definitely give the relief and make the kid independent. So again, it depends on various factors. We can look into it. The most important thing is homeopathic medicines are safe. Even they don't have single side effect. That's the reason you have to use homeopathic medicine for autism. How efficient they are. Homeopathic medicines are very efficient in treating autism. There are a lot of kids who are benefited by autism. In my experience, whatever the autism kids I have treated, almost all the kids have shown some improvement. That is the efficacy of homeopathy in treating autism. And timely, see, autism is not a short living disorder, it's a long disorder. Coming to time, so the brain's neuroplasticity, the brain can adapt and modify until the age of 13. From 2 years to 13 years is the golden period for autism, or not only for autism, for any psychiatric disorder or any brain related disorder, because brain grows in that period and it is highly plastic, means you can mold the brain in that period. So treatment for autism as early as possible, and at least until 13 years. You can take the treatment for autism after 13 years also, up to 25 years. But 2 years to 13 years period is a golden period for treatment of autism, and most of the people will see improvement in autism traits by using homeopathy. Of all those, what is the specialty of homeopathy? You can see, we call autism as a spectrum disorder, right? Spectrum means in every aspect autism is a spectrum. You will have spectrum of symptoms, right? Huge variety of symptoms. The reasons for autism are huge variety. When we go to the reasons, we will see there are huge number of reasons for autism. And also presentation of autism is huge. And also, if you take one component, genetic component, there are 500 to 1000 genes that are responsible for autism. It is also a huge spectrum. Each autistic child is different. It is like a thumbnail. You cannot find two autistic children having same traits or same pathology, even pathology. So some people will have low vasopressin, some people will have high vasopressin, some people will have oxytocin deficiency, some people will have abnormal brain size, abnormal brain structure, some people will have abnormal neural connections. Even the pathology or pathophysiology of origin of autism is completely different. No two kids will have same pathology. Keeping that in background, homeopathy is also a spectrum of medicines. There are around 5000 medicines in homeopathy. So each patient will get a different medicine. If I get 10 different autism cases, I need to give 10 different medicines. So what is dominating in this kid? Or their social behaviors or social deficiencies or repetitive behaviors. Based on that, I will give different medication. So what is the age? How the symptoms are presented? So is it problem with verbal skills, or is it problem with non-verbal skills, is it problem with emotions or restricted behaviors or repetitive actions? So based on that, there will be different symptoms. Not only based on the symptom, they can be causes. So one cause is using more ultrasound when the kid is in the womb, or there are different causes for it. Based on the cause also, there are spectrum of medicines that can be given in homeopathy. That is the importance of homeopathic treatment. It is also a spectrum of medicines. Having all these advantages, homeopathy is the best treatment in front of you for autism. For treatment of autism, we have two types of consultation. One is online consultation, next one is in-person consultation. In online consultation, you can have video call or audio call with us. So we will discuss deeply, and we can see the kit as well, and also you can exchange whatever the reports you have. The treatment can be given to your doorsteps wherever you are in the world. In India, it will take 3 days. In US, it will take 4 days. Other than US, to any other country, it will take 5 days. Except for Pakistan, we can send to any other country in the world. This is about online consultation. In-person consultation, we have multiple branches. Wherever you are, inquire about the nearest branch. You can call to this number, inquire about the nearest branch, and reach us personally. Next one is how to contact us. You can call or WhatsApp us on +91 is the country code for India. 7997 101 303 is the phone number, and our website is www.fidicus.com. So you can reach out to us on this number. Next one is why Fidicus homeopathy. There are lot of homeopathic doctors, lot of homeopathic corporate hospital. Why you need to contact Fidicus Homeopathy? Because we have the highest chance of health in case of autism. We have highest success rate for autism compared to any other homeopathic treatment or any other treatment in the world. The treatment will be transparent. So whatever we are doing, we will give you complete information. We will give black and white information to you. Then you can decide whether to take treatment or when to stop. It's everything transparent and it's up to your choice. Next one is personal care. So in the world of AI, in the world of technology, the human touch is gone. But with Fidicus Homeopathy, the patient interaction with the doctor or the staff of our clinic, we have ensured that it is more personal. When you call to this phone number, we will not say for a particular thing press 1, for a particular thing press 2. It will be directly answered by the well educated and soft people who has interest in personal care will deal with you, and even the doctors will recognize you. It is not that every time you come to the clinic you put to a new doctor and you have to explain everything. So personal care is very important for us. Because of all this, highest success, transparent treatment, personal care, and we have highest chance of health. Fidicus Homeopathy is the best choice for you, because at Fidicus Homeopathy you have the highest success. Thank you.